Welcome to ChiroTV. This is Dr. Mario Torres Leon, radiologist, and today we're going to be talking about one of my favorite things. And we have our friend here who is already laughing. And why is it that I'm holding a little gorilla? Because we're going to be talking about kids in chirocare. And today I have Dr. Scott Darragh from Bay State Chiropractic, and we're going to be talking about children and chiropractic care. Welcome to the show.
Dr. Mario.
This is something that many people are asking all the time. Doctor, can I actually use chiropractic care for children?
Absolutely.
Talk to us about that.
Absolutely. Chiropractic care for children, not only is it extremely safe, but it's also drugless and it's also fun. It's also fun to adjust kids. They enjoy it.
So what I'm hearing is fun, drugless. Talk to us about that, because many physicians, we use medications, we give it to kids. But one of the things that I have found in my experience with kids and chiros is that you don't go down that route. And that is so important for so many parents watching the show right now.
One of the major myths and misunderstandings is that people say, why would you adjust a child? So this all goes back to the condition in which we diagnose. And a lot of times too, what happens is sometimes the condition called subluxation usually stems from a childbirth. So the birth process itself can actually cause a bone to misalign, causing certain potential problems, such as the list of what we're going to discuss in a few minutes.
Well, let's actually go and do that right now. Let's take some of those little kiddos and talk about some of the things that you see in your practice that are very common for kids.
So the most common subluxation symptoms could be anything from ear infections. Technically, chiropractic doesn't treat the infection, because you can't, but technically it's a dysfunction, not necessarily a bacterial infection. A lot of times colic. Colic is usually a subluxation of the middle thoracics, which goes into the lung. The nose comes out, goes to the lungs. Also, bedwetting, asthma, a lot of times too. And people always try to say, I don't understand, Dr. Scott, how does this relate to how does chiropractic adjustments help this particular problem? And it all goes back to the nervous system.
I just want to say something here for the audience. This is very important. He's talking about the word subluxation, which is that the alignment in that spine is not exactly where it needs to be, and that causes different changes in how all those nerves are working. Is that right, Dr. Darragh?
Absolutely correct.
Exactly. So not only are we getting those kids back to where they need to be aligned, but the anatomy or the different parts of the body are getting those messages that they need so that things are working back the way they should be working.
Correct.
So give us more examples about how we do that.
Well, we have different kinds of instruments, different kinds of tools. So we have, say, here's so it's called a speeder board. And a lot of times,
speeder board.
A speeder board. And the speeder board, one of the techniques, because there's about 125 different techniques that we use.
Wow.
So at the same time, too, we also have to make sure that what we do is comfortable for the child, and we also want to make it fun. So a lot of times, if I have a child's little head, I'll use OJ here. A lot of times, the tool will make a contact right here, up top, and just set the little drop very quick, very easily, very painless. At the same time, too, we'll also use a instrument, which is kind of like a gun kind of instrument, but it's also it's a percussive, very gentle, very low impact, and a lot of times the adjustments are, not only are they highly specific, but they're painless, and that's a big thing.
I love that. One of the things that I have seen through me being a chiropractic patient is that when I started doing this, is this going to hurt? Is this going to be painful? And the fact of the matter, it really isn't. So all of you who may have children out there and are concerned, what's going to happen to my child when I go to Dr. Darragh? The main thing is, it's going to be fun. It's going to be absolutely pain-free or painless, and you're not going to be using any drugs for that. What are some of the things that you see when those kids come and immediately after they get out of your table and you've been adjusting them and caring for them?
Immediately, sometimes they fill their diaper.
Wow.
Sometimes a constipated child will have a bowel movement and mom will come back and say, I have a dirty diaper on the way home from the office. That's a good thing.
Moment to celebrate. I love it. That's excellent.
A lot of times too, it's like they sleep through the night, or they don't have they're not relying on the medication. So they don't have to go down and spend 3 or 4 hours in the emergency room down at Children's Hospital. So that's a great thing. And these are the potential side effects of what we'd see in the office.
So one of the things that I'm also seeing in this experience, Dr. Darragh, is that sometimes parents don't tend to think that chiropractic care could be the first line of treatment. However, in many cases, rather than going straight for the guns that sometimes we prescribe antibiotics and things like that, we can really approach it in a more gentle way and seeing what's happening with the body and that alignment.
That's correct. So we're looking at, remember, structure dictates your function, whether or not you're 5 days old, 5 years old, 50 years old, or 25 years old. So your same spine, you have the same spine you had when you were a baby, of course. So that spine you have throughout your whole entire life. But usually the first neurological insult, that subluxation, that misalignment, can sometimes occur from the C-section, the vacuum, the forceps, even through pregnancy, even through the birth process, under normal
circumstances of delivery.
Normal delivery can also manifest into problems later on.
One of the things that we see the most is respiratory conditions, whether it's asthma, whether it's pneumonia, or symptoms that seem to be one of those. And I know that in your practice, Dr. Darragh, you tend to see some of these little kiddos that come in with those symptoms, and you've been able to treat them and care for them. Tell us about that.
So a lot of times people don't necessarily think of asthma as a chiropractic issue. The problem is that I should have a line of asthmatics out the door waiting to get under care. But a lot of times too, the first line of defense at the pediatrician's office is steroids, inhalers, theophylline, albuterol, that kind of approach.
Yes.
Then once they get that diagnosis of asthma, then they should be making their way into the office, because we want to see where there is any nerve interference, where those nerves are going to the lungs, because asthma, even though it manifests as a respiratory problem, is an immune system problem.
Right.
And the nervous system controls the immune system. So in chiropractic, we're looking to find where is that neurological interference that we could be helping that asthmatic.
85% of all the visits in the ERs of the United States alone, they're actually deemed unnecessary. So maybe your kid is one of those who's you've been taken to the ER instead of taking them to Dr. Darragh to be seen, and in fact, you may not actually have to have that kind of visit. So in this segment, we've been talking about how chiropractic care with Dr. Darragh could be absolutely caring, could be painless, and absolutely drug-free. Welcome back with Dr. Darragh to ChiroTV.
Isn't it time to take better care of yourself? If you're in the greater Boston area, see if a visit to Bay State Center Family Chiropractic is right for you. Dr. Scott Darragh promotes conservative chiropractic health care for all ages, from day-old infants to the elder population. Alleviate symptoms through total wellness, from chronic pain to migraine headaches, from chronic allergies to ear infections. A relaxed, pain-free visit with Dr. Scott delivers overall wellness by unlocking and unleashing your body's innate potential. Bay State Center Family Chiropractic is conveniently located at 340 Main Street in Melrose, Massachusetts, and accepts a variety of healthcare plans. For more information, give us a call, 781-662-3333, and visit us at baystatedc.com.
Millions of people from all over the world every single day suffer from headaches. Why is that? There's so many reasons, but one of the reasons is our heads weigh anywhere between 10 to 13 pounds, or over 5.5 kilos. Just think about that for a second, having a bowling ball right on the top of your body. And that is actually kept in place by small little bones, which are called vertebral bodies. Today, to discuss headaches and what to do about them and what can chiropractic care do for them, is Dr. Scott Darragh. Welcome to ChiroTV. Tell us about this problem that we have all over the planet.
Well, headaches, Mario, it's a multifaceted approach. There's many different things, and just like you said, our brain and our skull sits, and our head sits on our spine. The fact of the matter is that sometimes the vertebral bodies, as you were describing, the muscles attached, sometimes poor posture can ensue, and sometimes we can get these misalignments which actually go, or bones, which can go out of their normal position, aggravate and irritate the nerves, and actually misfire and send too many signals sometimes to the brain.
I just want to say something for all of you watching. This is the human spine, and the cervical portion, which is the neck, has 7 little bones. Then there is the thoracic portion of the spine, which has 12 of them. And then you go into the lumbar portion, and it has 5. Just imagine, all of these pieces are moving all day long. How many things can happen? And the nerves that are running right on the sides of the spine can actually get pinched. Tell us about headaches and those pinched nerves, Dr. Scott, and what can we do for them?
Well, they technically don't get pinched. They
Oh,
more get irritated.
Uh-huh.
And so when they get irritated, that kind of disrupts the normal function from the brain to the body, into the body, into the brain. So if these, in addition, add into that poor stress or lots of stress, add into that poor posture, people, in our occupation, these kinds of stressors all can add up to those irritated nerves, which will manifest into these headaches and migraines and dizziness and all these other factors which can result from up top.
That's fantastic. We actually have today a small brain here with us, and when there's pain in that neck and headaches, just think about all the electrical charges that are taking place in there, just like in this particular model. When you see your patients and they come to you with these headaches, how do you start working with them with no medications? Which is so important, because many people feel like, is he going to give me medication, especially if they have not been to see you before? How do you handle that, and what happens?
Most patients, when they come to see us, chiropractic is their last. They've already been to the neurologist, they've already been to the family doctor, the internal medicine doctor, and all these specialists, these headache centers and neurology centers. And the thing is that where chiropractic looks, when we take that x-ray, when we see what their posture and their structure looks like, they're not getting that test at their neurologist's office. So we're looking where no other doctor has looked.
That is so important. We want to say thank you to Dr. Darragh for being here on ChiroTV. And remember, it's painless, it's about caring for you, and it's safe. See you next.
Isn't it time to take better care of yourself? If you're in the greater Boston area, see if a visit to Bay State Center Family Chiropractic is right for you. Dr. Scott Darragh promotes conservative chiropractic health care for all ages, from day-old infants to the elder population. Alleviate symptoms through total wellness, from chronic pain to migraine headaches, from chronic allergies to ear infections. A relaxed, pain-free visit with Dr. Scott delivers overall wellness by unlocking and unleashing your body's innate potential. Bay State Center Family Chiropractic is conveniently located at 340 Main Street in Melrose, Massachusetts, and accepts a variety of healthcare plans. For more information, give us a call, 781-662-3333, and visit us at baystatedc.com.
Welcome back to ChiroTV. If you're getting old, does that mean it's the end of your life? My take on this? Absolutely not. I am Dr. Mario, and today I have Dr. Scott Darragh from Bay State Chiropractic, and we're going to be talking about what can chiropractic care do for you, do for me as we get older. Welcome to the show. This is something that so many people, in my experience as a physician, I've encountered. Doctor, I'm just getting old and just I don't know what to do. My body doesn't feel right. It doesn't have to be that way.
It doesn't.
How do we go about that?
Well, people have to realize, especially as we go old, we need to be moving. We need to be active. And so a lot of times our spine, our structure, our skeletal structure, those bones can sometimes get out of their normal position. They can become arthritic. And if those bones don't move, then all of a sudden they can cause pain.
And when Dr. Darragh is saying arthritic, really what that means is that with the use and age of the bones, sometimes they can become degenerated or they change in the shape that they have. So what can we do for that?
Well, one of the things that we provide and the healthcare service in our profession provides is that we try to make sure that we establish improved motion.
Wow.
And we try to get those bones to move where they haven't moved before.
That's right.
So we do this through various different techniques that are comfortable for the patient and techniques that are also effective at allowing them to have a better quality of life.
Dr. Scott, we have so many tools here that are something that you use daily. Tell us about this particular one.
This is what's called an arthrostim. It's a percussive instrument.
Let's use it on me to see how that works. Let's see how that
So
that
you're
works.
going to hear you're going to hear some percussive motions, and what this is doing.
No pain.
It's actually stimulating the brain from the inside out.
Wow.
And it's also sending a lot of receptors. So the technology nowadays in chiropractic has evolved in such a way that the instruments now make adjusting the spine and establishing movement and motion that much easier.
And what do we have here?
This is what's called a vibrocussor. And a vibrocussor is great for people that have a lot of soft tissue problems. So things where tissues and tendons and muscles and ligaments, things that get abuse through our daily stressors.
Like using your arms all the time or exercising hard. So how would you use that on me, let's say?
So if we were to actually work on, say, like a bicep, or a lot of times today I set a patient in with an elbow problem. He had some tendonitis from a fall.
Well, it feels
and
good.
So a lot of times too, and it does feel good. And it's at the same time too, it's very gentle, and it's also helping to
No pain
loosen
whatsoever.
up.
I don't feel any pain. Tell us about this one you have over here. This is a bigger one.
So a lot of times we want our patients to feel comfortable in the office. And so 75% of the effectiveness of the adjustment process is relaxation. So
Wow.
when people come into the office, there's enough stress out in the world. The last thing I want for them to do is have more stress.
I wouldn't want it.
So we just try to loosen them up. So we use what's called a G5 Genie Rub.
The genie rub. Ooh, I like that. That sounds good.
And a lot of times too, it makes a good noise, but it's also very comforting. And a lot of my patients call it like they feel like it's a car sander.
And I just want to send a message to all of you that are watching out there. The body has so many different parts. And if you think about it, all these parts are constantly in motion. As we get older and all those parts are rubbing and rubbing, they can change in the shape. But what Dr. Darragh is saying is, there is a way for you to feel completely alive again. You don't have to think, I'm old and I can move anymore. Dr. Scott, we want to thank you for really telling us about this. And as you can tell, I have been the patient today, and it's completely pain-free. Dr. Mario at ChiroCare, we'll see you right back.
Isn't it time to take better care of yourself? If you're in the greater Boston area, see if a visit to Bay State Center Family Chiropractic is right for you. Dr. Scott Darragh promotes conservative chiropractic health care for all ages, from day-old infants to the elder population. Alleviate symptoms through total wellness, from chronic pain to migraine headaches, from chronic allergies to ear infections. A relaxed, pain-free visit with Dr. Scott delivers overall wellness by unlocking and unleashing your body's innate potential. Bay State Center Family Chiropractic is conveniently located at 340 Main Street in Melrose, Massachusetts, and accepts a variety of healthcare plans. For more information, give us a call, 781-662-3333, and visit us at baystatedc.com.
Do you know that 85% of all visits in the ERs across the planet are unnecessary? And I'll tell you even more. Some of them have to do with back pain and what we call chronic pain syndromes. Lots of words, big words. But today, here at ChiroTV, we're going to talk about this in a way that you'll be able to get it with Dr. Scott. Tell us about this problem that people have so often. In fact, one of the words that people throw out there is sciatica. It's a big word.
It is a big word.
What does that mean?
It means usually your sciatic nerve is on the back of your spine and comes right off the what's called the pelvis here. So here are your hips, your pelvis, and the big bone right here in the middle is called your sacrum, and that sciatic runs right down the back of your leg.
And that's something that people are, these are the good medications here, good supplements, not really medications, but many people take medications for pain control because of this. What do you find with chiropractic care, which is completely different from everything else we see?
We try to identify the cause as to why people are having these issues.
That's right.
So we look at, when we take an x-ray of a patient, we're looking at it a little bit differently and analyzing it a little bit differently from the radiological standpoint. That would be at the hospital.
You know, it's interesting. As a radiologist, I have seen so many, thousands and thousands of different studies, x-rays, CAT scans, MRIs, and sometimes we say it's a completely normal study, but the chiropractic eye is different, and you see things differently, especially when you put your hands on your patients.
The way that we're trained, Mario, is that we're actually trying to identify structural, skeletal, spinal structural problems.
Yes.
And misalignments that actually are the reason why the patient is having that actual problem.
Well, think about this. When you're driving your car every day, there's so many moving parts in the car. The human body is no different. So look at this spine and all the different pieces that we have that are constantly moving. And as Dr. Scott is saying, he is looking for what's happening with the alignment of all those little pieces. And doctor, I would imagine when they're not in the right place, problems start to manifest as symptoms and pain. Isn't that the case?
Absolutely. But sometimes the problems have been there for years. So they may not manifest for a very long time. And sometimes it's as simple as reaching into a refrigerator or grabbing a can of peas that triggers the event. And next thing you know, oh, I can't move.
So many times I have seen x-rays. And the history that says is I threw my back off just moving without really doing anything major. And that's exactly what you're talking about.
Absolutely.
What do we have here to do with it? Show me this. This is an interesting tool you got here, an instrument.
So these two instruments right here, this is what's called a vibrocussor. It's used to help reduce a lot of soft tissue problems. So in addition to the structure, the vertebra which misalign, there's also muscles, tendons, bones, ligaments, and joints, things that actually support those the spine that actually can get very, very tight and cause a lot of pain.
That's fantastic. And I also like the fact that there's multiple supplements, dietary supplements, that can support the health of your spine. Isn't that the case?
Well, a lot of times you're actually helping to reduce inflammation.
Yes.
And that's the big word in today's society and in science, that we're actually trying to reduce inflammation in society. And one of the ways to reduce that is through omega-3 fatty acids, fish oils.
Dr. Scott, I want to thank you for all this information. This has been absolutely fantastic. There are options. Thanks for joining us here in Chiropractic Care, ChiroTV, and we'll see you right back.
Isn't it time to take better care of yourself? If you're in the greater Boston area, see if a visit to Bay State Center Family Chiropractic is right for you. Dr. Scott Darragh promotes conservative chiropractic health care for all ages, from day-old infants to the elder population. Alleviate symptoms through total wellness, from chronic pain to migraine headaches, from chronic allergies to ear infections. A relaxed, pain-free visit with Dr. Scott delivers overall wellness by unlocking and unleashing your body's innate potential. Bay State Center Family Chiropractic is conveniently located at 340 Main Street in Melrose, Massachusetts, and accepts a variety of healthcare plans. For more information, give us a call, 781-662-3333, and visit us at baystatedc.com.
Pregnancy is something inevitable and a very important and essential piece of the life of many women around the planet. And in fact, right now you may be pregnant. But today we're going to be talking in ChiroTV about, is there a room for chiropractic care during pregnancy? With us, Dr. Scott Darragh. Doctor, is chiropractic care for pregnant women? That's a big question.
Absolutely, without a doubt. Chiropractic is so vital for a pregnant woman to be under care for many different reasons. First and foremost, what's called optimal fetal positioning of the pelvis. And at the same time, too, understand that we try to make the pregnant woman extremely comfortable.
This is really important for all of you watching out there. And it's the fact when the fetus is growing, it's completely changing the position of the spine. It's changing the position of the different organs inside the abdominal and pelvic cavities. So chiropractic care can actually, based on what you're saying, Dr. Scott, really be gentle with the fetus and with the mother-to-be during that period of time so that that anatomy is receiving what it needs.
Very much so, and in the sense that you're actually working with the body. So a lot of times the adjustments that we use we utilize techniques that are very gentle. We utilize techniques that are very comfortable for the pregnant mom. And at the same time, too, we make to ensure that the pelvis is lined up so that there's no extra torsion and so that the baby can grow naturally without any extra interference.
And one of the things that I really love about chiropractic care during pregnancy is that many women cannot have medications while they're pregnant. And this is a problem that we encounter. So tell us about that drug-free intervention and care for that pregnant woman.
A lot of women, when they come into the office pregnant, they're either having back pains, they're having sciatica, they're nauseous, they're having a lot of problems with their pregnancy. And a lot of times chiropractic can be a very effective modality in terms of for caring through them and making and ensuring that their pregnancy is a lot smoother.
Dr. Scott, one of the words that we hear many, many times is the fetus is in breech position. And when they hear that, immediately they get really, really anxious. Oh my God, is something going to happen with the baby? Tell us about your certification and what you do to really assist the mother and the fetus in that change of position.
In chiropractic, we have a certification course through the pediatric organizations called Webster Technique. And Dr. Webster was the one who invented this. And what it is it's basically you're trying to reduce any constraint as soon as the baby is identified breech, which, as you know, is the opposite position. So to try to minimize and try to turn the baby on a gentle way, you can actually help minimize the chances of a C-section.
That's fantastic. So what Dr. Scott is saying is that instead of the baby having the head first down in the mother's pelvis, it's actually the pelvis or the legs. This is really important. What we've been discussing here today is that chiropractic care is a fantastic option for all of you pregnant women out there, or if you're thinking about getting pregnant, so that we can keep track of how that fetus is doing during pregnancy. Thank you so much for being today with us here in ChiroTV, and we'll see you right back.
Isn't it time to take better care of yourself? If you're in the greater Boston area, see if a visit to Bay State Center Family Chiropractic is right for you. Dr. Scott Darragh promotes conservative chiropractic health care for all ages, from day-old infants to the elder population. Alleviate symptoms through total wellness, from chronic pain to migraine headaches, from chronic allergies to ear infections. A relaxed, pain-free visit with Dr. Scott delivers overall wellness by unlocking and unleashing your body's innate potential. Bay State Center Family Chiropractic is conveniently located at 340 Main Street in Melrose, Massachusetts, and accepts a variety of healthcare plans. For more information, give us a call, 781-662-3333, and visit us at baystatedc.com.
Welcome back to ChiroTV. I'm Dr. Mario, and today we're going to be talking about something that many people ask. Is chiropractic care just for adults? Well, actually it isn't. This goes all the way from the moment that you are in your mom's belly all the way down to just about to be passing on to the other side. So today we have Dr. Scott from Bay State Chiropractic Care, and we're going to be talking about all the different things and the services that chiropractic care has available for you during the course of your entire life. Dr. Scott, tell us about that.
So one of the biggest misconceptions is people don't seem to understand is chiropractic really is not, it's not about your spine, it's not about your pain, but it's about your life. So it actually encompasses a lifestyle, not only a lifestyle of living, but also, as Dr. Mary was saying, it also starts from when when you're in the womb, to when you're a child, to when you're an adolescent, as an adult, and even into the elderly years. So you can utilize chiropractic many different ways for many different problems, and you're basically kind of chiropractic works with your goals and objectives.
One of the things that I have learned through being a patient of yours is that there are three things to me that are so essential, and I know that you go by them. One of them, chiropractic care is about caring. Big point for you. Tell us about that.
Well, chiropractic is a hands-on healing art, and as the third largest healthcare profession in the world, we still are very underutilized and people don't know what we do. So the caring is, as soon as I touch you, there has to be a transference of care, and you instantaneously know, okay, I'm confident in this individual. They know what they're doing. They're going to take good care of me. As opposed to I exude confidence in my hands, or I don't.
And this is something really important because human beings, we are meant to be touched, and when we are touched with that kind of care, it really makes a difference. The second point that I see, and is so relevant, so important, is that it can be absolutely painless. So you have a lot of different tools that you use all the time, and yet they don't inflict pain on your patients.
Absolutely not. And like I said, a lot of times the technology is getting to the point in the chiropractic profession where we are using a lot of percussive instruments. We're using lasers in care.
Wow.
We're using a lot of special tables to not only to care for patients' spinal problems, but at the same time too, make them very comfortable so that they enjoy coming in to get adjusted.
Dr. Scott, something that we see too is that the body, as we can see in this model, is made out of so many different parts. And as we tend to age, those parts, they may undergo what's called degeneration or changes in the shape of those different body parts. And that leads many people to using medications. And chiropractic care is about medication-free. Tell us about that.
Well, we live, definitely, as we all know, we live in a drug-infested world. And everybody, it's not about what medications you're on, it's about how many.
Right.
And so we try to get our patients to understand that, you know, in our office, you're not going to, our job is not to necessarily get you off medication, but you know what? It happens a lot. That's what we call a side effect, a good one. So a lot of times our supplements that we give to patients are helping to enhance, support, and make your body stronger so that you may not have to rely on that medication for the rest of your life, because we all know the damaging effects that it causes on our body long term.
Dr. Scott, one thing that I have experienced in my life as a patient of chiropractic care is that there is that communication and that contact, just like the two of us right now when we go to see the chiropractors. And that really changes the experience of health, how the body feels, and also allows you as a professional to give that person what they need.
Well, we have to find out what the patient is actually looking for, because their goals and objectives may be completely different. They may want to try to avoid surgery. They may want to just be able to pick up their grandchild. They may want to have a longer drive in their golf game. Who knows? So everyone's idea or everyone's objective is different.
As you can see, chiropractic care goes through the entire span of your life. It's about being in a caring environment, painless and medication-free. Thank you, Dr. Scott, for being here with us on ChiroTV. We'll be right back.
Isn't it time to take better care of yourself? If you're in the greater Boston area, see if a visit to Bay State Center Family Chiropractic is right for you. Dr. Scott Darragh promotes conservative chiropractic health care for all ages, from day-old infants to the elder population. Alleviate symptoms through total wellness, from chronic pain to migraine headaches, from chronic allergies to ear infections. A relaxed, pain-free visit with Dr. Scott delivers overall wellness by unlocking and unleashing your body's innate potential. Bay State Center Family Chiropractic is conveniently located at 340 Main Street in Melrose, Massachusetts, and accepts a variety of healthcare plans. For more information, give us a call, 781-662-3333, and visit us at baystatedc.com.
Thank you for tuning in today on ChiroTV. And if you have any questions about some of the segments that we've seen today, or you want to see them again, you can go to baystatedc.com. I'll say that again, baystatedc.com.
And I'm Dr. Scott Darragh from Bay State Center Family Chiropractic. And just remember, it's easier to stay well than to get well.